Hey guys, I'm Dr. Joseph Hulick. Today I want to review with you tonsil stones. You know those little white things in the back of your throat? What are they? What causes them? How do you know you have them? And lastly, I'm going to give you 3 tips that you can use and incorporate in your everyday life to prevent these from giving you problems. So, what are tonsil stones? Really, they're basically a combination of different things that are inside of your mouth, and when they're all grouped together, form a little ball, a little soft mass. So, think of this as almost kind of like you're making cookie dough or a recipe for something. So, the recipe for tonsil stones is one, debris. And when I say debris, what I mean is food, different things that you're consuming and putting in your mouth. Number two, bacteria, which are naturally in your mouth. Three, mucus. When you think of mucus, just think of your saliva, so kind of like a binding agent to get them all together. And then lastly, dead cells. So you know when someone's talking and they have the little white spots in the corner of their mouth, or you spit out mouth rinse and there's some things that sink, those are basically dead cells that your mouth is shedding. So when you think of these, think of cookie dough actually. So a good comparison, the best way I could describe this is if you were making cookie dough, you take a little bit of flour, sugar, butter, you put them in a bowl somewhere for everything to hang out, you mix them together, and what happens? They all stick together, they form a little mass. Literally, it's the exact same thing with your tonsil stone. So I actually have a little piece of cookie dough here. So when you think tonsil stones, think of cookie dough, and that's really kind of how they come together. I hope this doesn't ruin cookie dough for you guys. And this is chocolate chip cookie dough. I know most tonsil stones don't have little black spots in them, but that's what they are. We just reviewed what's in the recipe for tonsil stones. The next thing I want to go over with you is why they happen, or kind of where they like to hang out and what causes that. So when you think of your tonsils, most people with the tonsil stones, they're actually talking about their palatine tonsils, which are at the back of their throat. So I want to compare a sponge to your tonsils. So imagine, or whenever you wipe off your dinner plate with a sponge, think about all the different things that get stuck inside of here. Your tonsils are kind of the same way. They have all these like little nooks and crannies where things can kind of hang out and debris can get stuck. So imagine if you put a sponge basically where your tonsils were on either side. This is our picture of a mouth. This is supposed to be the tongue in the back of your throat. I know it kind of looks like an acorn, but bear with us. We're doing our best here to give you a good example. So imagine if you put these sponges here. Think about all the different things, even just in one day, that would probably get caught up in here. All the different bacteria, debris, things you're consuming, everything that's passing by here. Think about everything that would get kind of caught up and like to hang out in there. So here's a couple signs that you might actually have tonsil stones. How do you know that you have tonsil stones? Number one, a lot of patients experience not really difficulty swallowing, but it just feels like something is stuck in the back of their throat, or they have like something lodged back there. So if you're eating, drinking, and after you get done, you wake up in the morning and you feel like something's back there, that could be a sign you have a tonsil stone. Bad breath. A lot of patients report bad breath, because obviously, you know, that's a combination of different things in your mouth. It's hanging out kind of in a secluded area, and when all these things get together, they produce a bad odor. So a lot of patients who experience these experience bad breath and kind of a bad taste in their mouth. And lastly, if you just look in the back of your throat, a lot of times you'll actually see the white spots. Sometimes you can look back there and not see anything, and they can kind of be developing. But the majority of the time, if you feel something and you look back there, there's going to be like a little white lump back there. So for the sake of this video, I want to give you my top 3 tips that you can do to hopefully prevent tonsil stones from forming. Number one, great oral hygiene. What I mean by this is basically just taking great overall care of your mouth. So brushing, flossing, making sure that it's a clean environment to decrease the chances of developing something like this. Number 2, irrigation. When I say irrigation, what I mean is even if it's water, because I don't expect you to carry around a toothbrush in your pocket, is water after a meal. Swish with it, irrigate, maybe even gargle with it a little bit, just to kind of keep everything clean, and incorporate a mouth rinse in your routine if you're not already. Use it once, maybe twice a day, and rinse with it like the instructions say, and then even gargle with it a little bit, because that'll help keep bacteria cleaned away from your tonsils and help irrigate any food, debris, things like that that are stuck back there. Lastly, your diet. So diet plays a huge role in these, and with your diet, just think about everything you're consuming is always changing the environment in your mouth. So if you change your environment to be more favorable to tonsil stones, and that's most likely what's going to happen. So some of the things, or the 3 key things within your diet that can lead to these, are caffeine. So how much coffee, how much soda, energy drinks are you consuming? These have a drying effect on your saliva and can dry your mouth, which will increase that mucus, which will increase the chances of all that stuff binding together. Alcohol kind of plays the same role here. A lot of patients experience these after they've maybe had a long weekend of drinking, or if they're drinking consistently, or they suffer from dry mouth. That can lead to tonsil stones. Lastly, really sugary things, sodas, candy bars, even if you're just snacking frequently throughout the day, all of these things can help contribute to developing tonsil stones. Okay guys, if you liked this video and you thought we had some useful information, some helpful tips for you guys, make sure to subscribe to our channel. Hit the subscribe button below. If you're watching this video on YouTube, or not YouTube, excuse me, Facebook or Instagram, please share our videos. We make them to help you guys, to help educate you the best that we can, not only for patients at our practice, but for patients everywhere. So one of the things that you can do to help us is to share our videos with everyone. With tonsil stones, remember, the majority of these are going to be harmless. They're going to be really small. Most likely they'll kind of come out on their own. If you swallow it, it's not a big deal. When in doubt, if you feel like you have some concerns about tonsil stones, or maybe it's larger than you would expect, always consult or schedule an appointment with your physician or your dentist to have them evaluated. So thank you guys for tuning in. We're going to make some more fun videos for you guys. Thanks for your time.